Welcome to MedEd's production of Neurovascular Crisis Caring for Stroke Patients. My name is Tara Orgon Stamper, and this is module Thrombotic Ischemic Strokes. So when we talk about stroke, there's multiple different types of stroke. There's ischemic stroke and hemorrhagic stroke. When we talk about ischemia and the actual definition of ischemia is the lack of oxygen to an area of the brain that requires it in order to function. Here we can see a blood vessel, and inside that blood vessel we have plaque, we have ruptured plaque, and we even have a blood clot. Got a lot of things going on in this blood vessel. But the point is that blood flow is not able to reach an area where it needs to go. And so when blood flow can't deliver oxygen to an organ, to an extremity, to what have you, then we have ischemia. Merriam-Webster defines ischemia as a deficient supply of blood. Hi, welcome to MedEd's production of the CPN exam review. My name is Beth Paton, and this module is called About the Test and Test-Taking Strategies. The objectives for this module is I'm going to discuss the test content outline for the Certified Pediatric Emergency Nurse exam, and we're going to discuss different types of test takers and some strategies to overcome test-taking barriers. So first of all, let's talk about why should you get certified in the first place? Why are you listening to this module? Why should you take the test? Why is this important? Well, for lots of reasons. First of all, certainly it demonstrates or shows recognition of a specialized knowledge as in pediatric emergency nursing, and I think that's huge. I took this exam when it first came out, so it was first released. I said, you know, I had been at that point an ER nurse for probably 6 years, just to show my age a little bit. So, when the exam first came out, I said, I want to take this. This is what I want to show that I have this specialized knowledge in pediatric emergency nursing. And certainly it's been demonstrated to increase your likelihood of professional advancement. It enhances your professional credibility. So, like, you know, not only am I an ER nurse who's worked for a long time, but also I have maintained or been able to attain the certification in my area of specialty and expertise. It does demonstrate professional growth, and there have been studies that show that it greatly increases your job satisfaction and improves patient care and potential for better compensation. So the history of the exam, interestingly, and again, Welcome to MedEd's production of the CPN exam review. My name is Beth Paton, and this module is called Anatomy of the Test, Test-Taking Skills. The objectives of this module are to discuss the test content outline and to discuss different types of test takers and strategies to overcome test-taking barriers. So first, I want to talk about the two certifying bodies that are available for you to receive your Certified Pediatric Nurse, or CPN, certification. The first is ANCC, or the American Nurses Credentialing Center. The website is listed on your slide. The second one is the Pediatric Nurse Certification Board, and the website is also listed on your slide. Basically, both of these certifying bodies are very well recognized. They're very well used. If you're trying to achieve the certification for magnet status, either one of these certifying bodies is fine to take your exam through. There's really, from a professional standpoint, not a difference between them. So, why get certified? First of all, it's certainly recognition of specialized knowledge in pediatric nursing. It really shows that you have gone or taken that extra step to become recognized as a pediatric nurse. It's certainly important for professional advancement. Some hospitals or organizations actually require it for advancement in clinical ladders. It enhances your professional accountability and credibility. It demonstrates that you have shown professional growth. There have been some studies and data that shows that it improves or increases your job satisfaction, and also certainly improves patient care and the potential for better compensation. On average, nurses who are certified in their area of expertise or specialty tend to make more than other nurses. So here's two statements, one from